Nasopharyngeal carcinoma is common in Asia, where high-dose external radiation remains the primary treatment. The internal carotid artery, or the ICA, is within the radiation field at most of the time. Pseudoaneurysms can develop from the involved segment. Rupture from ICA pseudoaneurysms, also known as carotid blowout syndrome, can be disastrous. It usually presents with severe hemorrhage from the ear, nose, or oropharynx. Due to the deep-seated nature of the bleeding site, airway and hemodynamic status can be compromised. After initial hemostasis by nasal or ear packing, digital subtraction angiogram is obtained to identify the bleeding pseudoaneurysm. Surgical ligation of the parent artery with or without bypass has been the traditional treatment, yet with high morbidity and mortality. Endovascular treatment provides a possible alternative with fewer complications and better outcome, which includes two options: endovascular trapping or stenting. Endovascular trapping of the involved ICA and pseudoaneurysm has been proved successful in achieving immediate hemostasis. Here the angiogram shows a pseudoaneurysm at the left ICA cervical segment. Deployment of balloon in the ICA or manual compression during angiography is used to test the tolerance of brain to permanent occlusion of the carotid artery. After compression of the left carotid artery in this patient, contrast injection from the contralateral ICA shows adequate cross-flow through the anterior communicating artery. Coils were then deployed to the left ICA for permanent occlusion, which is confirmed by subsequent angiogram. In cases where the occlusion test fails, patency of the ICA needs to be maintained. Stents are used to reconstruct the arterial lumen. Flow-diverting stents are recently gaining popularity and success in treating ICA aneurysms. The animation here illustrates the deployment of stent endovascularly using a guide-wire system. A flow-diverting device is placed across the aneurysm neck. Stasis of contrast is seen within the aneurysm, and subsequent thrombosis leads to gradual occlusion. When the stents are deployed in tandem fashion, covered surface area of the vessel is increased, and hemostasis can be achieved. Post-procedural angiogram here shows no more contrast filling of the pseudoaneurysm.